Seniors, this could be a matter of life and health. This opening line is a strong warning. It's saying that the topic being discussed isn't just important, it could affect your life and health. For older adults, even something that seems small like a medication can lead to serious consequences. This sets the tone and tells viewers, pay attention. This is serious. Did you know that some of the most commonly prescribed medications could actually be increasing your risk of falls and balance problems? This line introduces a surprising fact. Most people believe prescribed medications are helpful, and they usually are. But what many don't realize is that certain medications can have side effects that cause dizziness, weakness, or confusion. These side effects increase the risk of falling or losing balance, which is extremely dangerous for seniors. The line creates curiosity and concern by challenging what people assume about medicine. Today, we're revealing 7 popular drugs that are silently putting millions of older adults in danger. This sentence introduces the main point of the video, a list of 7 medications that are commonly used but dangerous in a hidden way. The word silently is powerful. It suggests these medications cause harm without obvious warning signs. The phrase millions of older adults shows how widespread the issue is. It's not just rare, it's something that could be affecting you or someone you love right now. If you or a loved one takes any of these, you need to watch this. Now, the message becomes personal. It encourages the viewer to keep watching because the information might directly apply to them or someone close to them, like a parent or grandparent. It builds emotional connection by reminding viewers that this issue isn't distant, it could affect their own family. Stay safe, stay informed, let's dive in. This final line wraps up the intro with a positive and encouraging tone. It says, the best way to protect yourself is through knowledge. Let's dive in is an inviting way to say, let's get into the important details now. It's friendly, reassuring, and sets the viewer up for what's next in the video. Blood pressure medications, beta blockers. These are often prescribed for high blood pressure or heart problems. This sentence refers to beta blockers, a type of medication that doctors commonly give to people, especially seniors, to lower blood pressure, treat irregular heartbeats, or manage heart-related conditions. They're widely used because they help the heart work more efficiently. But here's the catch: beta blockers can slow your heart rate too much. The phrase "here's the catch" means there's a hidden downside. While beta blockers are effective, they can reduce your heart rate more than necessary. A heart that beats too slowly may not pump enough blood quickly to your brain, especially when you stand up, causing dizziness or lightheadedness when standing up. This slow heart rate can lead to a condition called orthostatic hypotension, where your blood pressure drops suddenly as you change positions, like going from sitting to standing. This can make you feel dizzy, faint, or unsteady, which is very dangerous, especially for older adults. That sudden drop in blood pressure is a top cause of dangerous falls. Falls are one of the leading causes of injury, hospitalization, and even death in seniors. And this kind of dizziness from medication is a major contributor. What seems like a harmless side effect can actually result in serious accidents, like hitting your head or breaking a bone. Diuretics, water pills. Because diuretics increase urination, they can cause dehydration, a condition where your body loses more fluids than it takes in. Along with fluid, you also lose important minerals called electrolytes, like sodium, potassium, and magnesium. These electrolytes are vital for muscle strength, nerve function, and balance. This is especially risky for seniors, whose bodies already have a harder time maintaining hydration and balance. 3. Especially low potassium, which affects muscle function. Among all electrolytes, potassium is the one most commonly affected by diuretics. Low potassium, called hypokalemia, can make your muscles weak or crampy, cause fatigue, interfere with heart rhythm, lead to poor coordination or instability. Potassium is essential for your muscles to contract and move properly. Without enough of it, even simple walking or standing can become difficult. 4. Weak legs and balance problems? This might be why. This closing line connects the side effects to real-life symptoms. If you're experiencing wobbly legs, unsteadiness when walking, fatigue, or near falls, it may not just be aging. Your medication might be the cause. Many people don't realize that diuretics can weaken the body in this way, especially if potassium isn't being monitored. Sleeping pills, benzodiazepines, and Z-drugs. 1. Pills like zolpidem, Ambien, or diazepam, Valium, can linger in your system longer than you think. This line refers to sedative medications or tranquilizers specifically. Zolpidem, brand name, Ambien, used for sleep problems, insomnia. Diazepam, brand name, Valium, used for anxiety, muscle spasms, or sleep. These drugs are part of a group known as benzodiazepines or similar sedatives. What's important here is the word linger. It means these medications stay in your body longer than expected, especially in older adults. As we age, our metabolism slows down, and the liver and kidneys clear medications more slowly. That means the effects of these pills might last into the next morning or longer, even if you took them the night before. 2. They reduce your reaction time and can cause grogginess, confusion, or even hallucinations. These are the side effects of such sedatives. Reduced reaction time. Your body and brain respond more slowly to things around you, like getting up suddenly, walking, or avoiding obstacles. Grogginess. You may feel drowsy, heavy-headed, or in a fog, even after waking up. Confusion. Seniors may feel disoriented, forget where they are, or make poor decisions while under the drug's influence. Hallucinations. In some cases, people may see or hear things that aren't there, especially with higher doses or when combined with other meds. These effects greatly impair alertness and coordination, making normal movements risky. 3. Especially at night when falls are most dangerous. This line highlights when the risk is highest. At night, visibility is lower. Many seniors get up to use the bathroom, and in a dark room with sedatives still in their system, they're less stable. This is when falls happen most often, and they're more likely to result in serious injury, like broken hips or head trauma, because help may not arrive quickly. Falls at night can go unnoticed for hours, especially if the person lives alone. Antidepressants, SSRIs and tricyclics. 1. Many older adults take antidepressants. Antidepressants are medications used to treat depression, anxiety, and sometimes chronic pain or sleep disorders. It's very common for seniors to be prescribed these medications because mental health challenges like loneliness, grief, or chronic illness can affect mood as people age. 2. But these meds can interfere with balance, coordination, and alertness. Here's where the side effects come in. Balance. Antidepressants can affect the brain chemicals that control movement and posture, making it harder to stay steady. Coordination. These medications might cause your muscles to feel slow or shaky, making it tougher to walk smoothly or use stairs safely. Alertness. Some antidepressants have a sedating effect, making you feel drowsy, foggy-headed, or less mentally sharp. Together, these effects increase the chances of a fall, especially when moving quickly or navigating unfamiliar environments. 3. They also increase the risk of orthostatic hypotension. Orthostatic hypotension is a medical term for a sudden drop in blood pressure when you stand up after sitting or lying down. This can cause symptoms like dizziness, blurry vision, feeling faint, unsteadiness, or even blacking out. 4. A fancy term for sudden drops in blood pressure when you stand up. This line simplifies the medical jargon. It reminds viewers that orthostatic hypotension just means your blood pressure drops too quickly when you stand, a major trigger for sudden falls or near falls. Antidepressants can relax blood vessels, which lowers blood pressure, and in seniors, this effect can be exaggerated. Pain medications, opioids. This sentence recognizes a very important fact: managing pain is a crucial part of living well, especially for older adults. Many seniors experience chronic pain, which means pain that lasts a long time, sometimes months or even years. This pain can come from arthritis, which causes joint inflammation and stiffness. It can also result from surgeries, where the body is healing. Injuries like fractures or muscle strains can cause ongoing discomfort. Additionally, various health conditions such as nerve problems, osteoporosis, or cancer can lead to persistent pain. Because of all these factors, pain relief is not just about comfort. It helps seniors stay active, sleep better, and maintain independence. Ignoring pain or letting it go untreated can severely affect a person's quality of life, mood, and overall health. Managing pain is essential for quality of life, daily movement, and sleep. But the way we treat pain, especially with certain drugs, needs to be carefully monitored. 2. But opioids like oxycodone or morphine slow your reflexes and mental sharpness. Opioids, such as oxycodone, morphine, or hydrocodone, are powerful painkillers. They're often prescribed after surgery or for moderate to severe pain. However, these medications can slow your reflexes, meaning you react more slowly to things like stumbling, slipping, or needing to catch your balance. Reduce mental clarity, making you feel foggy, unfocused, or less aware of your surroundings. For seniors, this combination is risky, especially when moving around the house or climbing stairs. 3. They can cause drowsiness, confusion, and even impair muscle control. These are the common side effects of opioids. Drowsiness: you might feel sleepy or groggy, even during the day. Confusion: you may forget where you are, lose track of time, or struggle with decision-making. Impaired muscle control: your body may feel weak or uncoordinated, making it harder to walk, stand, or balance. These effects are stronger and more dangerous in older adults, especially when taken regularly or in high doses. 4. All of which increase fall risk. This line ties it all together. All the above side effects, slow reflexes, mental fog, drowsiness, poor muscle control, make it much more likely for a senior to fall. A fall while on opioids can lead to serious injuries, such as hip fractures, head trauma, or hospitalizations. Even a small misstep can have life-altering consequences for older adults on these medications. Antihistamines, like diphenhydramine, Benadryl. These over-the-counter allergy meds are sneaky. Many seniors take them for sleep or allergies, but they can seriously affect your balance, blur vision, and dry you out, causing dizziness and instability. Diabetes medications, especially insulin or sulfonylureas. If your blood sugar dips too low, called hypoglycemia, you can feel shaky, confused, or weak. That can make you fall before you even realize what's happening. Keeping blood sugar stable is crucial. Combination effects. Here's something many people overlook: it's not just one drug, it's the combination. Many seniors are on multiple medications. And when these interact, the side effects can snowball, increasing your fall risk dramatically. Who's most at risk? If you're over 65, recently had a medication change, or live alone, your risk is even higher. That's why understanding these drug effects is not just helpful, it could save your life. Talk to your doctor. Never stop a medication on your own. But do ask your doctor or pharmacist to review your meds for fall risk. There might be safer alternatives, lower doses, or timing adjustments that can make a big difference. Stay active, stay steady. Strength training, balance exercises, and even light stretching can fight back against drug-related weakness. Your body's balance system needs regular movement to stay sharp and stable. Simple home safety checks. This sentence emphasizes the importance of making your living space safer when you're taking medications that increase your risk of falling. If you're on any of these medications, this means if you take any of the drugs discussed earlier, such as beta blockers, diuretics, sedatives, antidepressants, or opioids, your risk of falling is higher because these medicines can cause dizziness, weakness, or confusion. Your home setup matters more than ever. Since your body might not respond as quickly or as steadily, having a safe and secure home environment becomes extremely important to help prevent accidents. Remove trip hazards like loose rugs. Loose rugs or clutter on the floor can easily cause you to trip and fall. Taking these away reduces that risk. Keep walkways well lit. Good lighting ensures you can see clearly when walking around, especially at night or in dim areas, helping you avoid obstacles or uneven floors. Install grab bars where needed. Adding sturdy bars in places like bathrooms, near stairs, or next to your bed gives you something strong to hold onto for support and balance. Nutrition matters too. Stay hydrated and make sure you're getting enough magnesium, vitamin D, and calcium. These support muscle strength and nerve health, which are essential for balance. Subscribe for more life-saving tips. This is a call to action that highlights the importance of the content. The tips shared can literally help protect viewers or their loved ones from harm. If this video helped you, or could help someone you love, this connects emotionally by reminding viewers that the information might benefit not only themselves but also family members or friends, increasing motivation to share or follow. Don't forget to click that subscribe button and tap the bell icon. This explains the 2 steps to stay updated. Subscribe to become a regular follower of the channel. Tap the bell icon to receive notifications whenever new videos are posted, so they never miss important updates. We're sharing more health and safety tips for seniors every week. This assures viewers that the channel regularly provides valuable, relevant content specifically designed for seniors, creating an ongoing reason to stay subscribed. And you don't want to miss out. This adds a friendly but persuasive reminder that staying connected will keep them informed and safe. Let's face it, falls are one of the biggest threats to senior independence. But with the right knowledge, we can spot the risks early, make smart choices, and stay strong. Thanks for watching. Stay safe, stay balanced, and I'll see you in the next video.